Hello friends, in this video you can learn about the diagnostic agent. So let's see what is diagnostic agent. These are the agents which are used to detect the abnormalities in the tissues that and organ their function. Also it will be useful for the clinical diagnosis. But this diagnostic agent does not have medicinal value or the not having the pharmacological effects. So that point you have to remember in your mind. So let's see the what is actual definition. Diagnostic agent are the compounds or chemical agent which are used to detect the impaired function of body organ. Means impaired function of body organ or to detect the abnormalities in the tissue structure. Means what? There is some impairment in the function of body organs. So for that detections you can use the diagnostic agent or the any abnormalities related to tissue. So that you can use to diagnose by using the diagnostic agent. Then let's see the classification of diagnostic agent. So this classification is based on the two class. First one is the X-ray contrast media. Okay, what is the X-ray contrast media? It is also known as radio opaque. Example is ioponic acid and propyl iodine. These are the two examples which is associated with the X-ray contrast medium or radio opaque. Then second one which is a agent used to test the organ functions. So it will be further classified into three class, which is a test for the kidney function, which compound is useful, which diagnostic is useful, which is the indigo carmine. Okay, so this indigo carmine is useful for the detection of the kidney function. The second one to test the liver function. So example is a sulfobromothalin sodium. This sulfobromothalin sodium is useful for the detection of the liver function test. Then there are some miscellaneous compounds which are fluorescence, Evans blue and conglomerates. Okay, so this is a classification you have to remember. So basically two class. First one is radio opaque or X-ray contrast medium, and second one agent used to detect the organ function. It is also classified into two class, which is a phthalate dyes, and that dyes is also classified into the phthalate dyes and azo dyes. Okay, so no need to remember, but you have to remember these two class and their examples. Then these are the some examples from the diagnostic agent, which is the propyl iodine, ioponic acid, sulfobromothalin sodium, indigo carbide, Evans blue, Congo red and fluorescent sodium. So it will be, I have mentioned their properties, storage, uses, dosage form and the brand name. Okay, so let's see the first propyl iodine. So what will be the properties of propyl iodine, which is a white crystalline powder. It is odorless and very slightly soluble in water. Okay, then what will be the storage condition? It is stored in the well closed light resistant container. So uses we will be see later on, because of uses are most important in exam point of view. So let's see the dosage form. It will be available in the injection as well as the oil injection. So brand name for the propyl iodine, which is a dianosyl. Then let's see the second example, which is a ioponic acid. So what is property of ioponic acid? It is almost white or cream colored powder. Okay, it will be available in the powder form, but white powder or the cream colored powder. Then it is similar to the propyl iodine, odorless and tasteless. Then storage condition, it is stored in well closed light resistant container, and then it will be available in the dosage form, which is a tablet, and famous brand name which is a Telopec. Okay, then another one, sulfobromothalin sodium. So what is properties of sulfobromothalin sodium? Which is a white crystalline powder, odorless and bitter taste. It will be having bitter taste, but white crystalline powder and odorless. Then what is the solubility parameter, which is soluble in water and insoluble in alcohol. So this sulfobromothalin sodium, which is a hygroscopic in nature. So you have to remember it is stored in the tightly closed container. You have to store this sulfobromothalin sodium in the tightly closed container. Then it will be available in the form of injection. Then let's see the another one, indigo carmine. So indigo carmine, you can see the property, which is a dusky purplish blue powder, blue granules with the coppery lustrous and sparingly soluble in water. This is sparingly soluble in water. And this indigo carbide, which is affected by light, hence this compound is affected by light, you have to store in the well closed container as well as the light resistant container. So storage condition which will be stored in a well closed light resistant container. Then it will be available in the injection form and famous brand name which is a indigo carmine. Then let's see another example of diagnostic agent which is a Evans blue. It is a green color or the bluish green or brown powder. Then it is odorless and very slightly soluble in water and very soluble in the alcohol. Then in the dry form, this Evan blue is hygroscopic, hence it will be stored in the tightly closed container, and the Evans blue is available in the injection form. Then let's see the Congo red. Congo red is dark red color, reddish brown color powder. It is odorless and having the solubility in water. It is stored in well closed container and it will be available in the form of injection. So Congo red injection is available. Then let's see the last example of drug which is a chemical agent or diagnostic agent which is fluorescein sodium. Okay, so this is a orange red powder. It is odorless and tasteless, but it is freely soluble in water. And this fluorescein sodium which is a hygroscopic in nature, hence it is stored in tightly closed container. It will be available in the solution form.